This is Dr. Craig McInnes, and this is a continuation of our video blog series about veterinary cardiac ultrasound. One-dimensional, right side, short axis, left ventricular M mode. The M mode cursor is placed in the center of the two-dimensional left ventricular image and activated. The only thing seen on the one-dimensional M mode image is the thickness of the chambers and structures in contact with the M mode cursor. The M mode image scrolls like an ECG. The resulting two-dimensional M mode image allows a vertical, top to bottom, measurement in centimeters or millimeters for structural thickness and a horizontal, left to right, measurement of time elapsed during ventricular systole, or contraction, and diastole, or relaxation. Note the M mode anatomy of the left ventricle. Muscular contraction, systole, and relaxation, diastole, of the left ventricular free wall, IV septum, and right ventricular free wall are shown. Measurements of these chambers and structures can be compared to tables of normal measurements for dogs and cats. Note that at a normal heart rate, muscular relaxation, or diastole, occurs for a longer period of time than contraction, or systole. This is an important fact because most blood flow to the cardiac muscle occurs during diastole, when the cardiac muscle is not contracted. During times of stress or exercise, heart rate and cardiac contractions increase, while periods of relaxation and cardiac blood flow decrease. Prolonged periods of stress or exercise result in poor cardiac blood flow and decreased supply of oxygen and sustenance to cardiac muscle. This patient with atrial fibrillation has a sustained, though irregular, ventricular heart rate of 250 beats per minute, with very short periods of diastole for blood flow to the cardiac muscle. In general, prognosis for survival of an atrial fibrillation patient is 6 months after diagnosis. On the right side of this image, right ventricular chamber size has been measured. This was done to remind the sonographer to compare right ventricular chamber size to left ventricular chamber size. Then, all left ventricular muscle and chamber sizes have been measured in systole and diastole. Below these measurements are calculations automatically made by the ultrasound machine. These calculations are based on the measurements of chambers and structures only at the points of contact with the M mode cursor and do not necessarily apply to overall cardiac muscle and chamber activity. FS, or fractional shortening, is a calculated percentage decrease in the size of the left ventricle between diastole, or relaxation, and systole, or contraction. Fractional shortening indicates muscular contractility at the point of contact with the M mode cursor, but does not necessarily indicate overall contractility of the entire left ventricle. If some ventricular muscle shows increased or decreased contractility, other areas may increase or decrease contractility to compensate, and overall ventricular contractility can be normal. Fractional shortening is important because it indicates normal, increased, or decreased contractility of the left ventricle. EF, or ejection fraction, is a calculated percentage of left ventricular volume that is ejected from the left ventricle during systole, or contraction. Ejection fraction is based on ventricular size at the point of contact with the M-mode cursor and may not represent the whole left ventricular activity. A measurement called Simpson's rule can be used to double-check ejection fraction for the left ventricle. SV, or stroke volume, is a calculated volume of blood ejected from the left ventricle during systole. Stroke volume is based on ventricular size at the point of contact with the M-mode cursor and may not represent the correct left ventricular stroke volume.